love that Nancy has her camera on. More people want to turn your camera on. I'd love to see your face.
Thanks, Cassie. So has anybody here ever had any interest in like the medical field or nursing? Maybe that's some place to start.
Yeah.
Nancy, if you can also type in the chat, and then we can see that.
What are you guys interested in about healthcare or the medical field?
I thought of pediatrician too because I like kids, but I wasn't really sure if I wanted to fully pursue it.
I know somebody in the large group had brought up that something like that. That oftentimes it's very intimidating. It's the education level. It seems like such a long journey when they hear about how long it's going to take to do that. So I don't know, how did that work for you? Because you're at more of like an advanced level of nurse, of a nurse career. So like, at what point, like you were bedside for at what point were you like, it's worth it to keep going?
I think what's so great about nursing, and one of the reasons why I chose nursing, was there's so many options of what you can do with one degree. So if you like kids, you can work in pediatrics. If you don't want to work in a hospital, you can work in a clinic, or you can work for even the government or public health agencies. So there's a lot of different, like if you're looking for different work-life balances, there's a lot of ways you can be creative about, I want to work night shift, so if I have kids, I don't have to send them to daycare, or I want to work Monday through Friday, so I'm going to work as a school nurse or something like that. I just love that flexibility because I'm someone, I don't necessarily get bored at jobs, but I always want to try something new. And so I liked that with nursing, I could always try something completely different. And if I don't like it, I could go back to what I was doing before. Because pretty much everywhere, you can almost always get a job in nursing. I mean, there's always going to be sick people. There's always going to be aging people living in nursing homes. So there's always going to be a job in nursing. So I liked the flexibility. I liked the different options. And then I also just liked that I'll always be able to find a job. So I don't even remember what your original question is. Oh, yeah. So
yeah, about like the education.
How did I decide like to get an advanced degree? So then I worked as a nurse in a hospital for a while, and I really liked working in the hospital. And sounds kind of weird, but I liked working with really sick patients, really sick kids or really sick babies, because it was a good challenge for me mentally. You know, you're always having to learn new things. You're always having to manage a lot of different things at the time. So I kind of got to the point where I was wanting even more of a challenge. So I went back for my master's degree because if you kind of get tired of being a nurse and following doctor's orders and things like that, you can go back and become a nurse practitioner where you have complete independence as a practitioner, meaning like I can prescribe medications technically, you can diagnose patients with diseases. So it's in the state of Minnesota, I could open my own clinic if I wanted to. So it kind of brings you to that next level. So I can function as a healthcare provider like a physician would, but I didn't have to go to school for like 12,000 years to do it. If that makes sense.
And if anybody's ever been interested in different areas of the medical field, I know, I mean, Emily going to school, she has other friends that have had connections. And
I thought of opening a clinic. That's a really great question, Nancy. I personally haven't because I love working in the hospital setting. But when I was a student at St. Kate's getting my master's degree, one of my professors, she actually has opened her own clinic, and so I got to do training there, and she loves it. So it's like a good mix of, it's kind of like having your own business, right? You have to hire employees like nurses, medical assistants. You have to manage the budget. You have to be in touch with insurance companies to make sure you can get reimbursed for the care that you're providing. And so if you're someone who also like has, you know, kind of an entrepreneurial brain, or you like business too, that might be kind of fun. So yeah, I personally haven't, but I know people who have and really love that.
Yeah, well, that was, yeah, because the person that she was doing that clinical underneath that owned that, that clinic, she had been inspired to open it because it was in a high needs area. So she had opened that clinic specifically to provide services for underrepresented people.
Yeah, particularly she has a huge heart for caring for kids with mental illnesses, and so supporting kids with anxiety and depression who need a lot of help managing that, but also need just general health care like child checkups or strep throat, things like that. She can do it all. So
because then on the side, then she was also a professor at St. Kate's, so that was she was busy.
Jack of all trades.
But yeah, that was a great question. Yeah, maybe, I don't know, in case anyone's interested. So when you were getting your undergrad for nursing, how did that work for you to actually like transition from classroom work into like clinical, like getting hands-on? At what point do you make that swap and it starts becoming more hands-on?
That's a really good question. So what's unique about nursing is that when you're in your 4 years of college, you spend a lot of time learning that isn't in the classroom, as leading to that in clinical. And what that means is they want, when you graduate from nursing school, to be able to safely take care of patients in the hospital setting or the clinic. And so throughout your schooling, you do all of your classroom stuff just like everyone else does. But then whether it be in the afternoon or sometimes in the morning, you go to a nursing home or you go to a hospital and you're training with other nurses taking care of real patients. So over the period of like 2 to 3 years, they let you do a little bit more, a little bit more, a little bit more, depending on where you're at in your schooling. And so I liked that because as much as I, like sitting in a classroom and learning, I like doing things hands-on. And so it's fun to be able to interact with other people and ask other nurses, like, how did they get where they are? And so you do a lot of networking and meeting new people and being able to learn from a lot of different people.
Here's a question. At what point of your like hands-on training were you most nervous to actually do something? Was it like sticking somebody with an IV or something?
The first time I had to stick somebody with a needle was the first flu shot that I ever gave. That was really scary for me because in class you get to practice, but you don't practice on your friends. You practice on an orange. They give you a needle and a syringe, and you practice on an orange because the orange has thick skin, so it's kind of like going through the muscle. So then the first time you do it on a person, you're just so nervous. Like you obviously don't want to hurt somebody, and you don't want to do it wrong, and you don't want them to know it's your first time that you've ever done it.
I was going to say, did they know that it was your first time?
They did know because I couldn't do it without my professor present, so she had to come in the room with me, which then I think makes people realize, like, does this girl know what she's doing? And the patient was very nice and very open to me giving his flu shot. But what he didn't like is that my professor was very intense. And when they teach you how to do shots, they say it's like throwing a dart for anyone who's ever played darts. And so my professor was standing behind me saying, dart, 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 as I was like coming near him with the needle, and that just, yeah, that was when I was most nervous. My hands were shaking, but after a couple times, it was like that.
I'm trying to think. All right, let's grab a question. Somebody come up with a question. It doesn't matter what it is. It doesn't even have to be related to nursing. It could be about we've got one. Nancy's all about the questions. We love it. Oh yeah. I can't see them, unfortunately. Does anybody remember what the paper? Oh, nice. Okay.
Oh, yeah, they're there.
Oh, wait. Yes, we can.
Can you see them, or do you?
Yes. Yep. We just scroll all the way up. We can see them.
But if there's one that interests you,
if there's one that interests you specifically that you think would be great, point it out. I mean, we can even take some. So one was, what's the best career advice you'd ever received? Anybody else hearing that? I have no idea where the sound is coming from.
Somebody asked if there was other majors you wanted to go into.
Yeah, I had thought about going to medical school to be a physician, but I didn't want to spend so much time as a student, and so I ended up getting to take a lot of the same classes in college that people who are going for pre-med have to take, like chemistry and biology and microbiology, nutrition, all of that stuff. So I thought about going into biology or chemistry. Then I also thought about teaching, actually. I wanted to be like a K through 12 teacher for a while as well because I love working with kids. But I think, and Kyle and I have talked about this before too, with nursing, there are a lot of ways that you can be a teacher, kind of informally. So we're always teaching patients and families how to care for themselves and about their own health. So I like that part of nursing. It's kind of like you are a teacher on health and well-being. And then you can also be a college professor and teach people how to be a nurse. So it's kind of a good mixture of all of those things, getting to work in pediatrics, but then also kind of having other opportunities within. Advice to give to your younger self at the start of your career. Oh my gosh, don't be so stressed out all of the time. I was really scared when I was a new nurse. And so I think just telling myself that everyone is nervous and I am not going to know everything as a new grad nurse, but to just do the best I can and ask a lot of questions. I think it can be nerve-wracking to ask people questions because you don't want people to think you don't know what you're doing, just in life in general. But I wish I would have kind of done that and taken more advantage of the knowledge and expertise of other people I was working with, doctors or other nurses or things like that. So not be so stressed out all the time and ask a lot of questions.
Okay, jumping away from career questions and maybe focusing a little bit more on like college type of a question. And students always ask whenever we visit colleges, is did you ever do a study abroad trip while you were in college?
Yes, I did. I did 2 study abroads.
Would you advise students to do it?
Yes, always. So that's actually a really good thing to bring up because with nursing school, if you go to a 4-year college for nursing, you don't have a lot of flexibility in the classes that you take. It's pretty predetermined because it's required by law for people who then sit for board exam to be a registered nurse. They pass certain classes. Financing. And so there's only a couple different kind of electives you can take. So a lot of people who go to school for nursing can't do a study abroad unless they end up going to school for more than 4 years or they do it in the summer or something like that. But the college that I went to actually had what we called J term, which was you could take a class just for the month of January before spring semester started in February. And Luther actually offered shortened study abroad trips in the month of January. So you would go somewhere for 4 weeks at a time, which was kind of a nice compromise. It felt like kind of a long vacation. So I did one of those my junior year and my senior year. I actually went to Europe both times. And what I loved so much about it was that it was both of the times I was studying classes that weren't related to nursing. So it was kind of just a refreshing break from being in science classes all the time. And to learn something new, but then also to learn about, like one of them, for example, was about history. And so learning about European history while I was physically there and being able to go to museums and see different, old historic buildings and things like that as I was learning and reading about them.
So
and you meet new friends.
That was always something I regretted. I always thought there's a little bit of an extra cost, but they usually build it into your tuition. So like you're still paying for it like you would normally pay for a regular semester. And for whatever reason, when I was in college and the opportunity came for me to do that, for whatever reason, I felt like the extra $3,000 I was going to spend was like just too much. I wasn't interested. But now when I look back, I'm like, I should have done that because like for me to travel like that with a group of people that you're usually friends with, like they're all the same age, you just get that like that time of life to be able to travel like that. You'll never be able to do that for $3,000 or whatever little it is over your regular tuition.
And one of mine I did pay with my student loans, so it was like nothing. Still paying for it today, but that's fine.
Paying for it today, but you don't see it.
And then the second one I didn't have enough student loan money that year, and so the summer before that trip, I just worked at a nursing home taking care of patients that are residents in the nursing home, and so that paid for it. It was very worth it.
Did you get scholarships when you went to college?
I did. I got scholarships from Luther that were based on my grades. So I qualified for a scholarship my first year from my high school, based on my high school GPA and my ACT score. So silly. I should have just gone to the University of Minnesota for the same price. And then throughout the 4 years, if I maintained a certain GPA, I would also qualify for that scholarship.
Okay. Did you apply for any scholarships outside of, or did you just focus on like merit based from Luther?
When I was in high school, I remember my mom telling me like every day that I should be applying for scholarships. And I had no concept of why that was so important.
Sure.
We didn't have a very good detailed conversation about what student loans entail and what that would look like for me after I graduated and how much money I would be spending every month on student loans. So I applied for a handful, but not very many, and I think I got like one community-based scholarship. And if that's another thing I would tell myself if I could go back to that period in life is to apply for more scholarships for sure. It's worth the time.
All right, I'm gonna scroll. Does anybody have any questions? Drop them in. Nancy asks a lot of good questions. Yep. Oh, we got a new one. Thank you, Cassie.
What is some advice you give kids these days? Like about college, about jobs, anything? College.
Okay.
Apply for scholarships. And I remember talking about this last year too. If you are thinking of something like nursing or education, kind of majors that are pretty common, it doesn't really matter where you get that degree from, especially in nursing. Like I talked about before, there's so many nursing jobs that it really doesn't matter where you go. You're going to get a comfortable experience kind of across the board. So focus on, do they have the program of study that you want? Yes, but also focus on the other things like proximity to family if that's important to you, or cost of living on campus, or just all of the other things about your lifestyle. Because from an academic standpoint, you're going to get the same experience. So, what we look like? That's a good question, Robert. My current job is a Monday through Friday type job where I have an office. I almost tripped myself. So for me, I go to work Monday through Friday, 5 days a week for about 8 or 9 hours a day. So I go first thing in the morning at 8 o'clock and report to my office and check all my emails. And then throughout each individual day, it can look very different. Sometimes I'm teaching classes to new nurses who are coming to work at the hospital for the first time. Some days I'm in the NICU working with the nurses, answering questions about how to best care for each of the individual babies. Other days I'm working on quality improvement projects, meaning they were trying to reduce a certain type of infection that's happening in the unit. So every day looks really different, which I like. And we support a lot of different hospitals, 5 specifically. So sometimes I'm driving to a different hospital every day, which is nice. So I work with a lot of fantastic people, and it's a very social environment too. So I get along with my coworkers really well. So it's a positive experience for me, which I'm really grateful for. So about 40 hours a week is how much I work, which is a lot. I think in the future, once I pay off my student loans, I'd like to maybe work more like 32 hours a week and have Fridays off or something like that, and which there's a lot of flexibility with that in nursing too, in terms of how many hours per week that you want to work, depending on what you want to do in your free time. how do I maintain a work-life balance? I will be honest, that is personally hard for me. I love my job and I like what I do, and I'm very passionate about making sure that the babies in our hospitals are well taken care of. So I think about it a lot. I think about it when I'm not at work. About what I should do tomorrow, how can I improve something specifically. And so I have sometimes trouble disconnecting, but I think also that's because I love my job. So hobbies, I have to distract myself. So whether it be hanging out with family or friends or getting exercise, going to the gym after work to try and disconnect. But I think that's something I didn't expect either, is that maintaining work-life balance has to be self. I can do that for myself. Employers just want you to work. So if you want to work extra, they'll let you. So you have to kind of protect your own time and find hobbies to fill that for you. I'll say what I like best and least about my job. What I like best is knowing that the work I do helps babies be healthier and have a happy life. So that's very motivating to me because a lot of babies we care for are very sick. Is that better? Sorry, I'll stop. So what I like best is that I get to impact a lot of different babies and families and allow them to get out of the hospital and have a happy life together. What I like least about my job is that sometimes
What do you like least about your job?
you probably know better than what do I complain about.
Oh, I'm trying to think of one that would make sense.
Oh,
Yeah.
I don't know, you guys. For the most part, I really like my job. So maybe at this current phase of my career, what I like least is I don't spend as much time with patients as I used to, which when I first went into this job was a feeling, but sometimes I miss that. So just hanging out with babies for 8 to 12 hours at a time.
I think. Sure. Oh, sorry. I apologize for any feedback. I'll try and be gentle. When you were, maybe this would be something, when you were like an actual like bedside nurse, do you feel like you took work home with you very often? Like if like you were working with a patient consistently and something happened that impacted you negatively?
I think when I was a new nurse, I did bring kind of the emotions of my job home with me a lot. So the baby was really sick or passed away, like that was really hard for me. And so that's where kind of having those hobbies or things on your days off to distract me were really helpful. So healthy lifestyle, working out, spending time with friends, really important.
Is it better now?
Robert's
That's just his picture. Okay. Robert, you're sitting so still. I don't get it.
Looks so realistic.
Cool. Yep. All right, we've got like 3 minutes left. Does does your job require that you travel?
That's a good question. No, it doesn't.
I mean, right now you kind of bounce between a couple hospitals because you
travel locally.
Yeah, like Fairview owns multiple hospital kind of networks, so sometimes you pop in.
So my office is in Minneapolis at the University of Minnesota, but sometimes, like I said, I have to go to other hospitals. So on those days I'm traveling and then I'm driving from hospital to hospital, but not like airplane traveling to different states. I can do that, like to go to conferences, to do continuing education, to learn more about specific topics, and my job will help support that and help me for that, which is really awesome. But I'm not required to travel or go be away from one person at a time.
But if you were to, for some nurses, they choose to, like, especially like during this COVID stuff, that you can apply for jobs to be travel nurses, and that's like your main gig. Is that they, like, so COVID, they have places that need a lot of nurses because of the increased need, and then they call these agencies where these traveling nurses work, and then they say, hey, we need you to go to, you know, Cincinnati or whatever,
Yeah.
and then those nurses will travel there for like 4 weeks, 4 to 6 weeks.
Sometimes 12, 16.
Yeah.
Um,
And they pay
so if
really
you're
well, but
an
you travel a lot.
experienced nurse taking care of patients in the hospital, that's a really great option if you're, looking to pay off student loans or you're saving for, travels or
Yeah.
something like that. I mean, these nurses make like $4,000 a week sometimes.
Sure.
If they're working at a COVID hospital.
But that trade-off was that you're working closely with, in this situation, it was COVID patients. We're working directly with COVID patients. Sure.